They say knowledge is power, but you need the wisdom to understand what this actually means. Welcome to the Decoding Health podcast. I am your host, Dr. Urban A. Kiernan. Each week, we will share the stage with renowned experts as we dismantle the black box of knowledge and unravel the complexities of science and its practical applications in our daily life. This show is committed to illuminating topics ranging from personal health and wellness to cutting-edge biopharmaceutical advancements and beyond. Let's get started. Hey, welcome back, friends, to another exciting episode of the Decoding Health podcast. By chance, if this is the first time you're here, I am Dr. Urban A. Kiernan, your host for the next hour. I'm also joined by our technician, Ethan, who's going to be helping me out today because we've got an awesome geek out session today. I am so super excited with this. Our guest today is Dr. Thaddeus Connelly, or goes by Thad. I've met a lot of smart people throughout the course of my career, and he is the first Dr. Cube. For the uninitiated, he has 3 doctorate degrees. So he has a DDS, an MD, and a PhD. Incredibly fascinating guy. I'm not going to be able to do his intro justice. So Thad, Dr. Connelly, please welcome to the show, and over to you, my friend.
Great. Thank you. It's very much my pleasure to be here. First time I've actually ever done a podcast, so this is new to me. So I hope I do it justice. So I'll give you my current status is that I am an oral and maxillofacial surgeon. I am just got full professorship at University of California, San Francisco, Department of Oral and Maxillofacial Surgery. I've been I see from LinkedIn that I'm celebrating my 23rd year at UCSF, but that includes the residency and the PhD and all that stuff. It all started out I guess, growing up, wanted to be in the healthcare field, wasn't quite sure in what aspect. My mom was a nurse. And knew that I liked biology, science, all that stuff. And not to go too far in detail, but I remember the formative point to make my decision was a nephew of mine. He was a 4 or 5 year old, had brain cancer, and I watched him suffer from that, and he eventually died from that. And at that point, I said, well, I think it would be, this is what I want to do is become a doctor and learn more about this and see if there's any way to make an impact. And so kind of that sort of set me up. I ended up going to the University of Miami for undergrad, which I grew up in northern New York, so I was really tired of being cold all the time. And so I said, I early decision to University of Miami and did biology there. And then afterwards, I made one attempt at applying to medical school, which was I wasn't ready for. And so I sort of backed up, went home for a short time, and then ended up looking for a job, and ended up getting a job at a place called the University of Maryland Psychiatric Research Center. And no, I wasn't a patient there. So, but that's where I first learned how to do science. There's a guy named Paul Shepard, who a wonderful, very smart guy. And I did electrophysiology of the midbrain dopamine system, and we did that to study schizophrenia. And I actually spent almost 4 years doing that. Like I said, he really taught me how to do science, what science is all about. But toward the end of that, I realized that I wasn't going to be able to. It's a hard road just to get a PhD and go from grant to grant, and not be able to guarantee anything in life. So I figured I needed something else to do to make some money with, and so circled in on dental school. I had no idea what dentistry was about. I have no family that's dentist, and so I spent 2 hours in my local hometown dentist, and who happened to go to be an alumni of Columbia. And he wrote me a nice letter, and that plus the research I had developed got me into Columbia, and I went there for dental school. While I was there, I immediately knew that I wanted to be an oral surgeon. Continue on. While I was there, I continued on with my electrophysiology. I developed a microelectrode array to put into rats, moving awake rats, and that was very tricky. But it took me a while to build it, and just as I got it built, I graduated. So, but it was a really interesting process. And again, that had a lot to do with dopamine reward system, and things like that. That was actually in the Department of Psychology. So the dental school is up at the Health Science campus, which is in not Morningside, but it's in Washington Heights, northern Manhattan, and the Morningside is the big campus. And I would go down there and go to the psychology department in dental school. But that kept me going with the science and kept me on track. At the end of dental school, I applied for to be oral surgery residencies, and there's this thing called the match program, and you go in and you kind of go interview a bunch of places, and you choose your top three, they choose their top three, and you match to wherever those should meet. And ended up at the University of California, San Francisco. So I came out here in 2001. Just before the towers fell. So that was pretty shocking. I was in my first year. I was on my. At the time as an intern, you have to do call in the hospital. And I remember waking up in the call room. We had this little black and white TV, and seeing these images on the TV, and I was like, well, the towers falling down. And it was just so surreal, but I had just been there months before, so that was pretty amazing. But anyways, very soon I knew in the residency program I also wanted to do my PhD. Being really invested in research. So during residency is a 6-year program. I did my while you're a resident, you get your MD. So I did the 3rd and 4th year of medical school and got the MD. And then you finish up, you do a year of general surgery, and then you finish up with 2 years of oral surgery. So it's a long program, and but yet I wasn't done. I was like, give me more.
You're a glutton for punishment. That's a lot.
But during the residency program, I was able to, I decided I wanted to do the PhD. I spent the last 2 years. I completed all the prerequisites for the PhD, and then after I graduated residency, I finished the PhD thesis. And in that, during residency, I studied oral cancer pain, and we made some nice contributions to oral cancer pain, along with a doctor named Brian Schmidt, and we did some nice investigations there. And but at the end of it, I was kind of thinking, concentrating on oral cancer pain is one thing. That probably it would be a good idea to figure out the oral cancer part, right, rather than just the pain part. So I started studying with my PI. Her name was Dr. Donna Albertson. And she really helped me along those 4 years to the point where I finally was able to put a thesis together, and then I was off to the races, back to oral surgery.
No, that's an incredible story, and for any of our listeners right now who are trying to figure out their life path, Dr. Connelly is. His story is very similar, but to an extreme level, and I think you kind of asked for that. Same with me. It's not a direct road normally to get to your destination. It's kind of all over the place. So if there's just something that you want to do, by all means, sit down and focus and stay the course, because eventually you'll wind up getting there step by step. I also have to go and state too that the academic route that Dr. Connelly here has taken, these are not chump institutions that he went to. The Columbia University School of Dentistry is one of the top in the nation, and UCSF, San Francisco School of Medical School, is one of the top medical schools in the entire world. So people, just to get into these academic institutions it's a huge testament. They just don't let anybody into these places. So, congrats to you, Thad, on doing this. And so now your day job is as an OMFS, oral maxillofacial surgeon, for people who've never seen this before. So you cut people for a living. And there's a ton of things that you can do with OMFS, from like trauma, total facial reconstruction, to doing significant dental implants. Like, there's a full gambit. What do you specialize in as a part of your practice?
I particularly specialize in jaw joint reconstruction. So if you think about disability, the number one reason for disability in the United States is lower back pain. So the second reason is TMJ, temporomandibular joint problems. I'm sure everybody knows somebody that has issues with their jaw joint that clicks a little bit, or sometimes it locks a little bit. Very common. And it's honestly a black box, even to dentists. And so, because of that, we actually wrote 3 books 6 years ago now, maybe 4 years ago, and tried to help the situation, tried to educate people. I've got a grant. We've looking at TMJ and how the bone structure changes, like say when people are getting orthodontics. So it's very common for me to see a 20-year-old woman who was in orthodontics for like 4 or 5 years, multiple times, and now they have jaw joint problems, and that's because their things in their jaw joint are being remodeled subtly enough to cause changes with the cartilage and how the cartilage moves, and that can progress really rapidly to jaw joint issues. And so I've got a grant looking at that issue specifically. But we do a lot of jaw joint surgery. Where I specifically operate at the San Francisco VA, and we're the only VA in the country that does a lot of jaw joint surgery. And I would say within the country, we're easily the top people. There might be a couple other centers that do quite a bit, but there's one company that makes custom jaw joint prosthetics, just like hip prosthetics, and we are their top customer every year. So we do a lot, but there's a big need. There's a huge need for it because there are a lot of people walking out there. And again, like I said, it's a black box. Dentists don't want it. Most oral surgeons don't want to know about it. Doctors definitely don't want to know about it. ENT people don't want to know about it. But then they end up cycling around. They go, it's an ear problem because the jaw joint's right in front of the ear. It's some other problem. Even before, but even now, people are just dismissed as they're crazy. I was like, they're not crazy. They have a problem. Chronic pain is making them crazy, and you would too. So that's the thing: is people they need to understand that there's an underlying anatomic abnormality that's causing them chronic pain and giving them psychiatric issues.
So let me ask you this: so like, if somebody, and a listener, is going through something, and that is the most frustrating thing in the entire world, is I have an issue. I can't clearly articulate what is going on, but there's something that is wrong. If somebody is having a mandibular joint issue, is it purely just clicking? You had mentioned pain. Is it pain in the area? Is it something radiating? Like, can you give some fidelity there?
Yeah. So if say you have an abnormally moving cartilage. There's a little cartilage disc in your joint that moves back and forth as you open and close. So your jaw joint is very unique, and as it opens and closes, but it also translates down. So it's called the ganglioarthrodial joint, right? So yet another very complicated thing, but it just means it can go like this and then translate down. And so this cartilage disc, it's very complicated. It moves back and forth as you move your jaw joint, right? And so the little things can interrupt the smooth movement of that disc. And so say make an analogy to your knee. If you twisted, or you pulled an ACL or did something like that. So your muscles, your body is going to automatically tell your muscles in your leg to function differently to protect your knee. It's just nothing you can do about it. It's just kind of a circuit in your brain, bad knee, splint that knee so to not make it worse, not make it hurt, right? And so same thing happens here. So if you're something inside your jaw joint, most of the time that cartilage is not right, your muscles here are going to activate differently. They're going to tighten and spasm, and they're going to eventually be painful because they're just tightened all the time. And then on top of that, you compound. Patient might be anxious anyway. A lot of vets have PTSD. They're already clenched down most of the time. So it gets into a cycle where the clenching causes anxiety, the anxiety causes clenching, and it all can start just from the abnormal moving jaw joint cartilage, the articular disc we call it. And yeah.
And could that end up like being some sort of issue in which it like affects hearing, affects vision, your sinus cavities? Is that a possibility too, or?
So indirectly, so when this area gets inflamed, a very common symptom I'll hear from patients that they have ringing in their ear because all the inflammatory mediators stimulate the hair cells and whatnot. But more so, it's the chronic activation of these muscles that can spread down to the rest of to the back of the neck, to the lats, and really to the whole back. And so everything's connected fascially. All the muscles have fascial planes that are more or less connected, and the whole thing can get activated. And then over time, their mouth opening becomes limited, their function becomes limited. Just gets more and more miserable as time goes on. So the way if we treat it initially is to make people more comfortable. And one way to do that is with a night guard to keep them from clenching so much, protect their teeth, and discourage the clenching and activation of the muscles. But specifically, and this is what my third pour is about, is we do Botox. We do Botox, and I've published on this as well. We do Botox in the masseter muscle and the temporalis muscle. And so what that does is it doesn't paralyze them. It weakens them to the point where they're much more comfortable. A lot of times people like this have headaches. The headaches go away. We can usually symptomatically control people reasonably well with the combination of Botox and the night guard. Sometimes, if the anatomic abnormality is enough, then there are some surgeries there's a couple of surgeries we can do if needed. But that we keep a lot of people health much more, their quality of life much higher than before. And and I know it works because we have people that we've seen 5-10 years. Every 6 months they come back for painful injections in their face. Injections in your face hurt, and so they come back over and over because it helps them.
Gotcha.
Yeah.
No, that's fascinating. And then you also said like a combination with a night guard. So, now that's something too that they prescribe for like sleep apnea. Right, is sleep apnea related to this in any way, shape, or form?
They are. Sleep apnea and bruxing are definitely connected. It's not particularly well characterized at this point, but there is absolutely some circuit in your brain. If you have sleep disturbances, and we can talk about that, then your likelihood of clenching your teeth all night long is higher as well.
And actually, that makes for a perfect segue here in terms of the lack of sleep, leading into significant neurodegenerative effects. And we've had a number of guests already on the show talking about Alzheimer's disease, and we've already introduced the glymphatic system. So, this is something that's newer in terms of the neurodegenerative space. Was only discovered 10 years ago. The way you describe the glymphatic system is like every night your brain, your central nervous system goes through a house cleaning effort. And so it tidies everything up. And now you've got this pile of trash that has to go somewhere. And the glymphatic system is responsible for getting the trash to the curb so it can get picked up and out of there. And
for the longest time, nobody knew how that happens. Then they just assumed that, maybe some of the glial cells or the supporting cells that do, phagocytosis, so eat this up and take care of it. And nobody really knew until, 10, 12 years ago. I talked to one of the ladies and one of the researchers at NIDCR, National Institutes of Dental Craniofacial Research, and she has pioneered some of this work. And you talk to her and say, "Oh, we knew about this 30 years ago." It's like, well, nobody really knew about it before
but you didn't. You saw something, but you didn't know what it was. So it's we'll give you a little bit of credit for something. But it's interesting though, because from a pure Alzheimer's disease standpoint, you've got an interpretation of how this goes. This is even being addressed by upper cervical chiropractors in order to keep all of that flow going. And there's actually a unique video by Jim McMahon, the former quarterback of the Chicago Bears, who was having significant mental issues, and his whole MRI of his brain changed after he got that flow going. And that relates back to the glymphatic system. Now, you as an OMFS structural guy, I need to hear your opinion regarding all of this, because this is totally different than everything else.
Right. Well, as always, everything's connected if you think hard enough. But yeah, I mean, it all kind of the story of how I kind of got on thinking about this track is my dad had some dementia. And it was bad enough where, he was in a nursing home, and it was during COVID, and he's already confused, and he doesn't know why anybody can't see. It was horrible. But anyways, unfortunately, he passed away a couple of years ago. But that got me keyed in on dementia and neurodegenerative diseases. I honestly didn't. I always used to kind of ignore them because I didn't know very much about them. And so, but I started picking things up little by little. And then, honestly, there was a big kind of like data dump sort of study out of the Cleveland Clinic. And one of their headlines was that patients who took Viagra had a 70%, that was their numbers at the time, 70% reduced risk of getting Alzheimer's than normal, than the other people. So that was like, well, that's interesting. What's Viagra doing? So, Viagra is a phosphodiesterase inhibitor. How does that relate to anything? And then so I started reading more and more, discovered this thing called the glymphatic system. And the glymphatic system is this, for those not aware, it's a passive sort of system in the brain made of astrocytes, and you may have already gone over this, but it's comprised of astrocytic foot processes that surround the cerebral vasculature, and they surround the incoming on the arterial side, and then they surround the outcoming on the venous side, and in between is the parenchyma where all the action happens, but the ins and outs are through that glymphatic system. And so started learning more about that, started learning, when is the glymphatic system active? How would you go about looking at the activity or the function of the glymphatic system? So We started doing some MRI imaging and to see if we could, because the imaging and the studies, honestly, there are very few in-human studies. They're like maybe a handful, if that. But most of the studies are done on small animals. And so, I'm a clinician. I do mostly clinical research. And so I have a relationship with the MRI. Here at San Francisco VA, we have the largest repository of Alzheimer's MRIs in the world. And so with they very much, I'm in the right place for that.
Absolutely, you are.
Yeah. And so we started looking, seeing how we could image the glymphatic system. The imaging has definitely improved, and we continue to work on that. But there's a whole story of why, why this happens,
Gotcha.
And we can talk about that.
Absolutely. And just to go and clarify for our audience in case, because you use some really, really big words right there. And, I'm keeping up with the conversation, but nonetheless, what Dr. Connelly was trying to explain is in the different compartments inside your CNS, you've got these very specialized cells, these astrocytes, and they basically act as like gatekeepers in channels regarding the movement of material, from the central nervous system into the rest of your body and vice versa. The key point on this when it comes to the glymphatic system is it only works while you're sleeping, and
only in non-REM sleep. So that's the key. That's the key thing. That's what ties all this together. Is that it only function in non-REM sleep, and the reason why is a very kind of a common sense reason is that when the system is active, you're flooding the brain cells, the synapses with fluid, because you need that. You're bringing in fresh fluid. You're cleaning out the bad metabolites, and while you're doing that, your synapses are not firing very coherently. They're not. It's very messy. They're flooded out, right? So your neurotransmitter released on the presynaptic side is not going to make it to the synaptic side with all this extra fluid, and so you want the glymphatic system to be active at times when don't have to think, right? And so the only time that is in non-REM sleep, because while you're awake, obviously you need your synapses to think. While you're dreaming in REM sleep, you need your synapses to consolidate memories, to forget stuff, to dream, whatever the reasons are for that. So you really don't want it during them. It's only in the deep non-REM sleep that your body can afford to activate the glymphatic system. And then we'll talk about the anatomy because it's very interesting of where the glymphatic system is and where it's not in your brain. And answer an important question is like, well, if all this floods out all your synapses, why don't you just stop breathing? There's actually a very interesting anatomic reason for that.
Let's get into it. Let's go.
Okay, so let's see. So take a look. You think about the jobs of the brain, right? So the cerebellum is where you have a lot of your balance, your breathing, your heart rate, all your autonomic functions. And if you look at the fluid management around the cerebellum, there's the third and fourth ventricles. They're very big. They kind of size to fluid chambers that ratio is low. So it's like a 1-to-1, right? It's more like a 1-to-1. Because they have these structures, and their fluid chambers they can handle that fluid exchange all on their own without the need for a glymphatic system.
Gotcha. And just so you know, Thad, we've got a picture of a diagram of the human brain up right now. So Ethan's already pulled that up.
Right, exactly. So that's it. That's exactly what so you can't lose control of your breathing or your heart rate or any of that autonomic stuff, right? So you need that. So there's no glymphatic system in those areas because you have those big ventricles there for the fluid exchange. So the areas where you can afford and you need to have the glymphatic system there is where you have the cerebral, where everything takes all the consciousness takes place in your cerebrum, right? Like your motor homunculus, your sensory homunculus, and all the midbrain structures that take it in, the thalamus and whatnot. The whole thing require those parts of the brain require a lot of energy. Their metabolic rate is very high. And so they need a different system than the lower metabolic rate of the cerebellum. And plus the anatomy, there isn't room for big ventricles up there. So they at some point in time, evolution said we need to have a different way to clean the brain and bring in fresh CSF. And so that's where you have the glymphatic system. The
Gotcha.
glymphatic
And hang
system,
on one second. You just said CSF for our listeners. That's cerebral spinal fluid. This is the riverway inside your central nervous system that just keeps all of the materials flowing, because all the way from your brain down to the end of your spinal cord, it's one big cavity, and everything flows through this material, the CSF. And it's important that there's this huge change out in material, because the amount of metabolic energy and waste produced in the brain is absolutely underestimated by the average person. Everybody talks about how much energy that they use working out, and that is trivial compared to the amount of energy that your brain actually uses and stuff. So with that, sorry for interrupting.
No. I mean, this is the whole reason why, like, if people stay up for 3 days, they die. It's because they're not cleaning out their brain. They're basically intoxicating their brain with metabolites, ammonia, whatnot. And people do. You've seen the cases where if sleep deprived people, they can just die because of that, and it's all because they're not activating the glymphatic system. And so it's pretty amazing, but if you look, it all kind of makes sense. Is that high metabolism has the high flow rate glymphatic system. Low metabolism has a different system with the ventricles around it in the cerebellum, and in the end, the glymphatic system has to have a place to go. And so I think it's important to mention that the glymphatic system empties up. We have 12 cranial nerves that exit the base of our brain and do different functions in the head and neck and control breathing and whatnot. And so the glymphatic system ultimately drains out near the cranial nerves. And then that somehow, it not very well defined, but as it drains out of the cranial nerves, then the lymphatic system takes over from there. But that there are choke points that where this becomes a problem, and where I think a lot of people can initiate the pathophysiology that starts neurodegenerative disease.
Yeah, and this is where things like in the upper cervical, your atlas, which most people don't even know what that is. Actually, if that winds up becoming dislocated, and this is where like upper cervical chiropractors actually come into play. Anybody who plays football has head trauma and stuff, and Western medicine just absolutely ignores it. I had a friend, or I have a friend of mine who played in the NFL. His atlas was off by 38 degrees. It was shifted 9 millimeters. Your two strongest ligaments in your body are holding your atlas to the base of your skull. He had broken one of them.
Wow.
Playing in the NFL. So this is not a trivial thing, especially when you go and you look at the demographics of those players and the amount of mental issues that go with those types of traumas. All of this stuff is related. So let's actually, going from the brain aspect of neurodegenerative into the skull aspect, because the skull is what holds all of this together. Are there certain things when it comes to the skull, and obviously as an OMFS, that you can kind of key on or explain? Is there even anything like evolutionary as a part of this?
Yes. So I'll back up just a little bit. I kind of concentrate on two things as being the issue. One is functioning of the glymphatic system, and I think about sleep. Sleep is I think is the primary driver of problems there, and then drainage of the glymphatic system. Mm-hmm. And drainage of the glymphatic system is all of the cranial nerve outlets where the glymphatic system exits. Okay, so there are two different pathways to get there. Having said that, I'm an oral surgeon, and one of the ways I make money to pay my mortgage and all the other stuff is to take out wisdom teeth. And probably like 10,000 years ago, nobody had any impacted wisdom teeth because they needed them to eat, primarily because their food was unprocessed. It was hard. It was fibrous. And they needed a full three molars on all four quadrants to be able to eat. As time progressed, we became more civilized. Our diet changed. Our diet became more and more processed, and that meant that we could survive with smaller jaws, and that smaller jaws translated into impacted wisdom teeth, right? And so that's one aspect of one repercussion of having a changed diet is that your jaws are smaller, and you don't have room for wisdom teeth. But that also, as the jaws get smaller, the rest of the cranial structure is getting smaller as well. And so one of the main outlets of the glymphatic system, at least in the middle anterior thirds of the brain, is the cribriform plate. And the cribriform plate is a structure kind of like right in between the eyes and back of the eyes a little bit. There's a very small little nerves from your olfactory nerve exit there and enter the brain to provide your sense of smell, of course. And if you block that exit, if that exit becomes compromised, then you're going to create a constriction point, and you're going to reduce the flow of the glymphatic fluid out of the brain and towards the lymphatic system. So it's kind of as an evolutionary consequence, we have smaller facial skeletons and smaller outlets to the glymphatic system, and they don't necessarily match up. Our brains probably got a little bigger. The outlets for the glymphatic system got a little smaller, and so you're getting towards an equilibrium where you're having issues, more and more issues with lymphatic flow. So that's one consequence of a smaller facial skeleton as a response to change in diet, right? Primarily, and there are other evolutionary things that probably occurred, but that's the big part of the story. But secondarily, maybe more importantly, is that as our jaws get smaller, the likelihood that we get obstructive sleep apnea increases. Because as our jaws get smaller, we have less facial skeleton to support our airway. And as we sleep, especially as we sleep supine and or laying on our backs, the likelihood, particularly when our soft tissue gets floppy as we all age, the likelihood of getting some sort of obstructive sleep apnea increases. And that again is a slightly different pathway, but then that affects your sleep. And so if obstructive sleep apnea creates micro awakenings, as you can imagine, as you choking on your airway, you're waking up a little bit, and that messes up with the cycle, the cycle, how your sleep cycle, your REM to non-REM, and more awake cycle. And so if you're not cycling properly, or you're not spending enough time in non-REM sleep, that is very much affecting the activity of the glymphatic system. And over time, I think that is a major driver. of neurodegeneration. So you've got those two things going on. Is you've got a mechanical obstruction in the outlets and the cranial nerves, but probably more importantly, you've got sleep disturbances generated from the smaller jaws, and more likely of a airway collapse.
That's really interesting, because if you go and, I don't know, being a nerd, especially with history, like even if you go and you turn the clock back 5,000 years ago, the human skull was very different, even from an airway perspective. People had wider and bigger noses, and like even if you go and we've been putting up images this entire time, Thad, but like even if you go and you look at Neanderthal versus Cro-Magnon man, which is what modern man is, it's just there's this striking shift towards a smaller airway. And even like in the remains of bodies in like the Middle East and in the pyramids, Egypt, and the burials that they found there, very, very different head structures than what we have right now. So all of this stuff is extremely, amazing. And if you don't mind, Thad, in terms of just kind of moving this over, we were talking about smell, and then obviously from Alzheimer's disease, this whole concept of thought and memory. So now we're talking about the way the brain actually works. Before we get there, though, I do want to bring up your blog, the Quantum Distillery. And so can we just like briefly explain this, because this is an absolutely incredible blog. It's brand new, but you're taking some deep, hardcore science and consolidating it into some of the very aspects that we're speaking about on this episode. So can you just describe Quantum Distillery, where the name comes from, maybe a little bit?
Well, originally I wanted to call it the Quantum Verve, but somebody already took that name. So I spent a couple of days thinking about what is it? And actually, the Quantum Distillery I like a lot better. So in general, what the Quantum Distillery is all about is exploring this new concept of quantum biology. We just discussed at reasonable length all of the letters I have behind my name, and none of those letters talked anything about quantum, anything there's no quantum medicine, there's no quantum biochemistry. It was all reasonably done on a classical level, where I say not a non-quantum level. And I watch a lot of. I'm kind of a nerd with physics and quantum physics and that sort of thing, and cosmology actually. And one of the guys who talks a lot about quantum physics was brought up the subject about quantum biology, and kind of like, what do you mean quantum? This was a couple of years ago maybe, and what do you mean about quantum biology? So of course I was intrigued and started learning more and more about it. And there is of course. Quantum mechanics itself, a lot of people, when you say that word, don't really know what you're talking about.
Absolutely. I was just going to jump into that right
there. So we have, of course, molecules, and then we have atoms, and those atoms are made of smaller things, and quantum mechanics basically deals with all those subatomic particles, and there are some very weird and fascinating phenomenon that happens at that level that don't happen in real life, but yet all of it underlies real life. And so the distillery part was like, well, how do we distill that down so we can understand a little bit of it? Because honestly, the people that do quantum physics, they argue about quantum mechanics, what quantum mechanics is anyway still, right?
Right.
And so it's there's a lot in the field, but there's real world stuff they do in quantum mechanics that's there, and it's there in the real world too. It's where you see it, and I think biology is one of the best places to see real effects of the quantum world.
And I'm going to interrupt you right there, Thad, just to go and give our audience a little bit of color on this, because quantum mechanics for everything in the universe is inescapable. But we don't have appreciation for it because, in my view, where we sit in reality is actually an anomaly. So quantum mechanics occurs at the very, very small, the atomic or subatomic level. And Ethan's putting up some images of, classical stuff, as well as, everybody's seen like images of like electron microscopes where you see actual molecules and it's this round sphere. And actually, no, it's not. It is, but it isn't. That round sphere is an electron.
So thinking about quantum mechanics is probability based, right? Classical is like you throw a ball, you know exactly where it's going to be. Quantum mechanics is you throw a ball, there's a probability distribution of where that ball is going to be, and so that I'm not a physicist. As a matter of fact, on my first physics course, I got a D. But nevertheless,
and you got into Columbia. No, I'm kidding. I'm kidding with that. No, but it's just one of those things that just when you sit down and think about it, it's almost like you want to go and take psilocybin after, because it is so trippy. So again, it's on the very small, and again, those images of electron microscope, you see these spheres, but in reality, that sphere does not exist. That sphere that you're seeing is our perception of an electron cloud, and that electron cloud might be two electrons, like in an s orbital. Now I'm totally geeking out on this, in which you've got these infinitely small subatomic particles that are everywhere and nowhere at the exact same time. And this is the probability that Dr. Connelly's talking about. And by a quantum physics standpoint, my table here, my microphones, my hand should be able to go right through them. And then on the converse side, it occurs on the very, very large scale when it comes to like galaxies and the universe. And then where we reside is somewhere in between. And we've got very different physics laws that are applied to us, Newtonian physics and everything that does not exist, in the quantum world. And, when you keep on saying in reality, well, there's our reality, and then you've got quantum reality. And it's really hard to go and wrap your mind around. But I agree with you, Thad, regarding the biology is the perfect place for this. And so let's kind of just dive into that, like some of the examples that one of our listeners can be like, oh, I'm familiar with that. That's quantum mechanics right there. Like a clear example off the top of your head.
So maybe I'll start out with something I already talked about with I've got in an upcoming blog, but is Botox. Botox works by so Botox works at the neuromuscular junction. It interrupts the signaling between the nerve cells that end up talking to the muscle cells. So it sort of cuts that communication. And the way it does that is Botox very specifically chews up one of the proteins that brings a vesicle, a little packet a little packet of neurotransmitter to the synapse. And so if the cell can't bring that packet of neurotransmitter to the synapse, then that synapse is non-functional. So that's a neurochemical paralysis, right? And so that Botox is one of the most potent toxins in the world that we know about because it is a super efficient catalyst. And it can just chew up that protein forever, and with a very low amount of toxin actually at work. And so classically, you can draw a structure of the molecular structure or the protein folded structure of of that interaction and what happens. But on the very finest level, on the quantum level, there are interactions with the electrons and how the electrons, they can actually overcome energy barriers without needing energy. So it's called quantum tunneling. So
Yep.
it's a really deep subject, but you can look at the classical. Say you want to look at enzyme kinetics and measure enzyme kinetics, and then see what you want, and you understand that on a molecular basis. But then, on what level? What else does the quantum effect of that quantum tunneling, where you have electrons moving through energy barriers they shouldn't be able to move through, and that's a very real quantum effect that I think you can measure just looking at enzyme kinetics. And of course, we have enzymes all over our body. I mean,
Right.
we don't function without enzymes. And so that's just one level. That was the easiest thing I could think of to sort of bring it out in the light. Is like there's a molecular effect that we can understand. There's this molecule fits in this pocket of that molecule and turns a screw. But then at the very smallest level, their electrons have to change energy, and electrons and this quantum tunneling is involved in that. So and there's a lot there's a whole lot of stuff to understand to even understand that. But that's sort of one way to think about it. The whole point of the quantum distillery is an emergence of the quantum world into the real world. And the balance between where the quantum world and the real world stops, I think, is much fuzzier than we think it is.
Absolutely. And, from a hardcore real world science standpoint, this is where things like quantum computing is coming into play. And you've got Microsoft's Azure, and IBM has this huge quantum computer that they developed, in which you are now dealing not with your qubits. It's like they use totally different nomenclature regarding it because of such a high level of computing capacity. But the human brain still outcomputes, from a constant data barrage standpoint, these multi-million dollar instruments like any day of the week. And you've got this classical view of how the way the brain functions, and even though there's these millions of dollars that have been spent on quantum computing, from what I've read, they've stopped trying to go and decrease capacity in terms of increasing capacity. What they're working on is efficiency, because the way they're
working on not losing their coherent, the making sure everything stays coherent or connected together, because you can lose coherence very easily, and so that makes everything messy. Yes. And so I think that's primarily one of the things they're working on. You're right.
Yeah, and there's a number of companies in which, as a part of this next generation of quantum computing, they're utilizing carbon nanotubes. Ever since 1984, the discovery of Buckminster fullerene, or buckyball, carbon-60, and then figuring out, wait a second, it doesn't have to look like a soccer ball. I mean, we've got an image up right now. We can actually elongate it. And these are some of the fundamental components that they are utilizing as a part of this. Buckyball has a 10 to the 26 to 10 to the 30. I'm totally butchering it right now, but from a quantum transition standpoint, that's part of the reason why I won the Nobel Prize, and it's being applied within these quantum computers now in this next generation they're developing out. But let's talk about this now from a structural standpoint. These are in the human brain.
Yeah, and that's life has evolved, being able to do quantum phenomena and have quantum effects at room temperature, at body temperature, right? So the brains we beat them to it, but yeah, I mean, the problem is not enough is understood about, like I said, that the difference between the quantum world and the real world. I mean, the quantum world and where you lose quantum effects,
Yep.
and where that boundary exists, and like there might not be a boundary, right? So I mean, maybe in your brain there isn't. But before we get almost end, I wanted to bring up the point where that. If the brain acts as a quantum computer, like the parts in your brain you used to think in the cerebrum, right? All the processing sensory part, all of that, that is turned off and on by activity of the glymphatic system, right? And
Yep.
so quantum systems need to be coherent. So they all need to be in the same state to be a quantum system, right? So that's very complicated, but basically there's a quantum state that all of the small particles share, and that quantum state is called coherence, and that coherence can be interrupted very easily just by flooding it with right, and so very easily, and so that's what the glymphatic system does, right? It floods the area, and any quantum state that exists gets decohered. Undergoes decoherence, and so maybe that's why you go unconscious, is because your brain floods, and all that quantum coherence is gone.
And even in terms of memory and the development of memories, and this was something that was discovered like in 2021. They actually kind of put all the pieces together. There's this, it's an ancestral gene. It's called the ARC gene, ARC. And they've known about it for a long time, is that it expresses these capsids, and I'll just jump into a little bit more. These capsids, which have lended to what's known as neuroplasticity. And if you go and you look at like back in my day when I was in school, how our memories performed, it was because of neuroplasticity. Like I have no idea what that means. Well, What they know now is this ARC gene is because of a merger with a cell and a retrovirus probably around 300 million years ago. And so like a retrovirus, the most common one is HIV. Everybody's heard of that. Right. And what happens is and they found this out, is you have to go, in order for memory to form, a ARC capsid with a messenger RNA is created, and then this can actually go in between different neurons and transmit this genetic material between everybody else. But if you go and you look at the structure of these capsids, they're all fullerene based, and we've actually got images of what these capsids look like, and these are the very same nanotube structures that they're trying to build into quantum computers right now. So, just by connecting the dots, there's something here between what we're trying to create in the real world that evolutionary wise has already been captured and is an absolutely beautiful, beautiful thing that every single person takes for granted.
Yeah.
So no, I think it's absolutely amazing on how, as we develop through this, there are some incredible questions that can be asked, because now you start getting into like the whole, because from a quantum standpoint, from a spin perspective and in tunneling, something might be happening over here, but in reality, because in the quantum world, space-time does not exist. You can be affecting a molecule on the other side of what we perceive as a known universe, but in reality, it's in the same spot.
Right.
And so if our thoughts, our memories, our thoughts, our consciousness we view it as present here, but they're actually taking place in a quantum state, are they actually over there as well? And it's just, this is now something of like science fiction with, hints of like quantum fact. There's even at Trinity College in Ireland doing NMR studies, they discovered that our bodies from NMR studies are quantum based, which, it makes sense, but it's actually something that's even detectable. And they're taking that over into consciousness. So, we're kind of delving into some deep water here, but you've got if you want to show everybody, you're actually wearing scrubs.
Yeah.
Right now you've got surgery coming up here, so I can't monopolize all of your time. In terms of Quantum Distillery, we've got the web link up right now. Everybody go and subscribe. This is some incredible stuff. It's a lot of fun. Any final thoughts or parting words that you want to give to our audience? This is great stuff all the way across the board.
Yeah, no, I mean, there's we could talk about this all day long.
Yeah, we could.
There's so much to it. But I learn a lot on podcasts. I have 4 kids and I drive them around a lot. And most of the time I'll have a podcast about quantum physics on, or quantum mechanics. And that's a pretty nice way to learn about things, especially when you don't have a lot of time.
No. Great stuff. So again, Dr. S. Thaddeus Connelly, Dr. Cubed. That still blows my mind. Thank you so very much for being on this show. Let's keep in touch. And if there's an opportunity to turn around and dive into some of this stuff some more, friends of the show, if you guys have comments, questions, throw them in there. We'll see if we can come back and add some more fidelity on this stuff. But there's a mountain of literature that is being built around all of this stuff. But again, we're just kind of tip of the iceberg on this. And then from a medical practice standpoint, if you're having any of this jaw pain and you're looking for help, if you're getting doors shut in your face, please go look up Dr. Connelly and see if we might have a solution for you, because pain is not life. That is not joy. So
a lot of times just having an answer means a world of difference.
Absolutely. So Dr. Connelly, thank you very much for your time, and we will speak to you soon. Take care.
My pleasure.
Individuals looking to unlock their true potential should look no further than Restore Health AZ. Whether someone is an elite athlete or a high performer in their industry, Restore Health AZ is there to help them reach new heights. Their groundbreaking restorative injection therapy and anti-aging precision medicine are designed to rebuild health naturally. At Restore Health AZ, they believe in the power of biohacking and regenerative therapies to optimize performance and longevity. Their innovative approach includes treatments like V-cell therapy, which harnesses very small embryonic-like stem cells to promote tissue repair and rejuvenation from within. For those who won't let pain hold them back, Restore Health AZ offers a solution. Interested individuals can visit restorehealthaz.com to take a pain quiz and get a free 10-minute consult with one of their experts. They can experience the future of medicine and revitalize their performance with Restore Health AZ.